everyone. Today we're going to talk about something very important. That's dental health. It's something that matters to all of us. I'm Fatima Muhammad, and I'm excited to be your host for this live show. We've got a great show lined up. We'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us all about the newest things in dentistry, how to keep your teeth healthy, and ways to get dental care that doesn't cost that much. Whether you know a lot about teeth or just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask questions during the live show. Before we start, let me tell you more about Dr. V. He's not just any dentist. He's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in the Dallas-Fort Worth area here in Texas. And guess what? He's even writing a book that's coming out next year. If you want to learn more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of your teeth. Let's begin our live dental show. Welcome everyone, and now let's welcome Dr. V to our show.
Awesome. All right. Thank you very much. You look like you go scooting up. Just come closer,
Let me get closer to you.
Yeah, right. Hi, everyone. I'm Dr. Kumar Vadivel, but you guys can call me Dr. V. I'm so excited to be here with you all today. Another a great show lined up and a lot of great questions lined up. Let me tell you a bit about myself. I'm a board certified periodontist, which means I'm specially trained in taking care of the gums and bone that surround your teeth. I'm also skilled in dental implants to replace teeth and a lot of oral surgical procedures. I'm part of the American Board of Periodontology and the American Academy of Periodontology. It's just a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialists almost like about over 2 decades ago, and we have 4 offices in the Dallas-Fort Worth Metroplex in Texas, and we are all about making sure that your teeth and gums are healthy and strong. Now, I'm here for you. I would love to hear any questions you might have about your teeth or gums, and you can ask your questions live here right now or send them for our next show. And your questions really help us make these shows not just helpful just for you, just people all around the globe and for everyone. So one more thing, if you like what you guys are hearing here, and if you like this young lady here, please let us know. Your feedback is super important to us, and Fatima has a lot of questions lined up, and don't forget to like this young lady on this show here, and like and subscribe to our channel so you won't miss out on the latest and the greatest updates and all the helpful tips we offer in this live show here about your dental and the gum health. I'm looking forward to talking with you all today and answering as many questions as we can have, and let's make our smiles as best they can be, right?
Yes, right.
You got it, man. Thank you.
All right, guys, we're going to jump right in. We have some great questions lined up, so I'm excited to get those answered. Our first question for the night is, do gum infections or swelling tend to worsen in fall season?
So are the gum the gum disease, is that kind of seasonal? Well, it can be seasonal because what happens is, as you guys know, when fall season comes, and this is kind of what we call it as a flu season, and people get like a lot of cough and cold because your immunity drops, and as the temperature drops, your immune system can weaken, making it easier for gum inflammation or infection to flare up. Cold and flu, as I said, increase for cold and flu season or flu infection in the fall season can cause a lot of mouth breathing or dehydration, which can dry out your gums and worsen the inflammation, and that can cause some gum problems also. And fall season comes, our diet changes, right? And diet and our habit change. Fall treats, people go for a lot of sugary drink with the holidays coming up, and pumpkin lattes.
That's my favorite. I was just about to say
with just the Halloween, we just had, and comfort foods, and people get like a lot of candy, sugar with the holidays coming up. So these all can accumulate a lot of bacteria, and that can irritate the gums. And guess what? People say that they get busy, they neglect the checkups. So people totally ignore the dental visits because of the holidays, and allowing the gum disease to develop and go unnoticed because they are so busy with the celebrating the holidays. So what you should do to avoid all of this: prevention, right? Stay hydrated, brush twice daily, no matter how busy you are, no matter how what you do for the holidays, and schedule your fall dental visit. Like as the end of the year is approaching, we call it as a use it or lose it. So you're going to lose your benefits if you don't use them, if you have dental benefits by the end of the year. So make sure that you're going to use your benefits to get your cleaning done, to stop gum disease and before they worsen.
Yeah. Schedule them, I'll say at least after Thanksgiving. That way you can eat good.
Absolutely, yeah.
Our next question is, my tooth is loose. Can deep cleaning and proper maintenance help reduce the shaking?
Absolutely. To a degree, doing the deep cleaning is going to prevent the gum disease from getting worse, and then it is going to tighten up. So what happens is, when you have gum disease and the teeth are kind of, the gums are kind of holding the teeth kind of like tight like this. So when you have gum disease, the gums kind of start separating from the tooth like this, and so now the tooth kind of become a little bit wiggly here now. So because the tartar gets between the tooth and the gum. So by doing a deep cleaning, it helps the looseness to get like a little bit tight, and now it happens by removing the plaque and the bacteria that causes the bone loss and the gum loss, and now it helps tighten tighten the gums. And with the healing, and the inflammation is going to go down, and the tooth becomes really stable, and then it's not going to be wobbly anymore. And to be able to do that, and you need to get your deep cleaning, of course, but at the same time, so you need to make sure that you're going to follow through with the best home care and the follow-ups on a regular basis with your dental office. So strict home care is essential, like brushing, flossing, and then rinsing your mouth with either a mouthwash or like even with the salt water. And follow-up cleaning is very, very essential, and then they're very critical. And sometimes the bone loss could be very severe to the degree that you cause a lot of damage. And if you go to your dentist or like come see a periodontist like us, and we check your bite to see whether your bite, because you're just biting on your teeth too strong, or you're slamming on the teeth, and that's what is causing, we call it as a trauma from occlusion, or like because of the bite. So we may adjust the bite, or sometime you may need some kind of a gum surgery or laser procedures, and these are all the things that we could be talking to you about. So bottom line, come see us, we can take care of that.
Yep. Before it comes out.
Oh yeah, that's right. Before the tooth comes out, because if we ignore, the tooth is going to fall out.
Yes.
Absolutely. With the holidays coming, absolutely no, you don't want that.
You do not want that. Our next question is, I'm worried my son may be using cocaine. During our upcoming dental visit next month, would the dentist be able to notice any signs of cocaine use through his oral health?
Absolutely. to a degree that we can tell whether the patients are like drug abusers, and definitely we can do that. Not all the time, because particularly if they're early abuse and they are in early abuse, and we may not be able to tell, and we may not be able to tell if they are abusing the drug in different forms, because cocaine, as you guys might know, can be abused in multiple forms. People inhale it, or people just inject it through the vein, or they sometimes even rub on the mouth, or hold this in the mouth and rub on the teeth and all of the teeth and the gums and all of that. So if they are particularly using the cocaine by rubbing it on the teeth, or rubbing it on the gums, and it is very possible they are going to have some kind of a gum recession, although we may not exactly tell, like, hey, it is caused by the cocaine, but sometimes we are able to, by looking at the type of the cavities and the type of oral hygiene, so we are able to tell. And sometimes people leave this cocaine or similar products in the mouth, and then that even causes like significant erosion, or even what we call it as a perforation of either the gum or the bone, and it can cause severe perforation. Those are signs of cocaine damage also. And a lot of times, like as I said, if they are not locally applying the cocaine in the mouth, we can still sometimes tell if they, as long as they are not early abusers. Sometimes we can say by looking at their teeth and looking at their oral hygiene and looking at the way they behave, and those are all the signs we can tell the person is actually using or abusing the cocaine. But as I said, if it is early, then sometimes you can't tell, and at that point, like, you really need to interview with the person and have a honest conversation with, particularly if somebody in your family, if it is your son, and definitely have a one-on-one conversation with them, or definitely seek advice from a counselor, and they should be able to help you.
Yeah.
Mm-hmm.
I didn't even know you can use cocaine there.
Absolutely.
I thought people just smoked it.
Mm-hmm.
Okay. All right. So our next question is, Doc, when is the best time to schedule gum surgery around busy holiday schedules?
Didn't you say that like it is time to do it now, right?
Yeah,
like,
now.
Before you get busy, right?
Yeah.
So planning ahead is the key, and as the holiday approaches, and people are going to get busy, and the dental offices are going to get busy, and we get busy here in the dental office because people want to use their insurance. So if you're particularly getting the gum surgical procedure, it is not like a regular dental visit. You can do it, but you got to plan ahead. Depending on the type of gum surgery you're going to need. I have patients, we do what we call it as a non-invasive laser gum surgery. They can heal real quick, like within like a day or two. Although we recommend them using some soft diet, and nothing that you cannot do. You can still be on the list of soft diets that we are going to give you after the procedure. It could be as low as like maybe a couple of days, and if you have extensive gum surgery done, you may need like about a week or 10 days or up to 2 weeks. So the bottom line, plan ahead, avoid the last minute rush, because as I said, last minute appointments fill quickly as we approach towards the end of the year, because people want to use their insurance before they expire. So book early, and consider recovery time. As you are coming closer to Thanksgiving, and as we are coming closer to Christmas, you may have some family visits, and you may have some gatherings, or you may be traveling. So plan accordingly, and then make sure that you are going to discuss with your periodontist or your dentist, whoever is going to be doing your gum surgery, whether you have enough recovery time. And then the other thing is, you got to be to be ready to avoid some kind of a limitations on the post-surgery because you can't do them all. Like I said, we are going to give you kind of a soft diet list that you need to be on sometime depending on the type of gum surgery that you are going to need. So you need to be able to avoid the sugary treats and some of the sticky holiday snacks, and that could really be irritating the gums. And being able to stay consistent with your oral care is very critical, particularly post-operatively as soon as having the gum surgery done. So follow the post-operative instructions carefully, and even during the holiday hustle when you're scheduling the gum surgery. And healthy healing, it always happens with a great and a brighter smile and for the new.
Yeah.
Right?
For
Yeah.
the new year.
Mhm.
Yeah.
Yeah, absolutely. Yeah.
Our next question is, does indoor heating affect gum tissue health? That's a good question because I like being warm.
Yeah. And as the fall season is approaching, as the things are getting cold here, people, man, like I go to the office here in the front here. These ladies stay right in front of the heater. It is just blowing, just heat on their face. So guess what happens? And when you have this indoor heating, that definitely can impact your your overall health, including your gum health. Then what you might realize, because what happens is with what we call it as a dry air effect. With the dry air effect, heated indoor air, it reduces the humidity, and it can possibly even cause dry mouth. And I'm sure you probably are experiencing with when the season is changing, you're causing some dry mouth and you're putting chapsticks all the time, which is definitely a factor that you will consider because you're dry. And a key factor that causes the gum irritation and the inflammation because your mouth is dry and you got less saliva. Again, going back to the dry mouth, the reason your mouth is dry is because you have less saliva. So when you have less saliva, again, it is because of the dry environment, and which helps neutralize the bacteria which is not there anymore. Now it is going to cause gum disease, and it's not going to wash away the food particles. Now it is going to cause cavities, and because you have the plaque sitting on the tooth now that you're not brushing and your mouth is already dry, now it is going to cause increased sensitivity of your teeth. So the problems, we talked about so many, but what's the simple fix here? Use a humidifier. Don't stay in front of the blowing hot hair right in front of it. Stay hydrated. Avoid mouth breathing and to keep your mouth moist and healthy. And get your regular cleanings done and use fluoride rinses. And if you're not using, particularly when you're eating, you may be eating a lot of sugary and other snacky items, and this is going to help protect against seasonal dryness related gum problems.
I feel bad now because I do wake up. My mouth be so dry. It's like everything be dry. But okay, I won't leave it in my face.
My mouth feels dry now. I'm going to take a sip of water here.
Okay. Is cortisol?
Corsidil.
Gel. So is that like Oragel?
Well, that's what they're asking.
Okay.
Yeah.
So it's, say it again.
Corsidil.
Gel, good for the gums.
So just from the question, and I can say this person is not from the United States, because Corsidil, where I went to training in England, and Corsidil is a product which is commonly used in England. I'm guessing this person is from the UK. Yes, a Corsidil gel is good for gums, and it treats gum disease and kills bacteria. If you guys are listening or viewing this from other parts of the world, Corsidil contains chlorhexidine, which is an antibacterial and antiseptic. It's a very powerful. Mostly it is not over the counter. It is a prescription based antiseptic or antibacterial. Either it is available as a mouthwash, which is the most commonly used form, in the United States and other parts of the world. It is available as a mouthwash, or it could be as like an ointment or a gel. It is very effective for gingivitis, against gingivitis, or healing ulcers and post-operative healing following any kind of a dental procedure or a gum procedure. So having said that, this is one of the most common questions like asked, when patients come to my office. I give them the chlorhexidine mouthwash, and then patients, start falling in love with it, and they're going to ask me now, oh doc, can I keep using it, forever? No, you can't use antibacterial mouth rinses forever, particularly the stronger ones. So short term, they are really good. Long term, they may alter your taste, or they may even stain your teeth. So avoid using them right after toothpaste, because you are going to make the antibacterial effect go away. Wait for at least like about 5 to 10 minutes before you're using them. And whether you are a candidate for like using the gel and whether you're going to benefit or not, just ask your dentist or ask your periodontist and follow the guidelines given by your dentist or your periodontist for the best results.
Well, I won't use it because I'll forget, and then I'll have stained teeth.
Absolutely,
So
yeah. Stained teeth is the most common problem there. Yeah.
Our next question is, at 78 years old, are all-in-4 dental implants worth the discomfort, pain, and cost considering my limited lifespan?
Man, you are 78 and then you are considered like you're thinking about your limited lifespan. I understand, but this is something that I talk with every single one of my patients. And this afternoon, we had a patient who is actually 84 years old. This afternoon, we just got the procedure, and I just got out of the procedure. We actually did some kind of a gum treatment around the implants that she had done, and she was having some difficulty in brushing around the implants, and that's why she had those implants placed at 77 years old. It has been a few years. She's starting to get some kind of a dementia, starting to forget things, and she's not brushing the implants properly, and that's the reason why she was here. And we put her to sleep, and we got all the implants treated, and all the rest of the teeth. She had a complete set of bottom teeth, with of course a few missing teeth on the bottom, to the degree that she's able to chew against the top teeth. But we were able to get her taken care by putting her to sleep and do the laser treatment on the top as well as the bottom, the complete mouth. But anyway, speaking of that, 78 years old, you still got a life to go. I always joke with my patient, hey, I'm only guaranteeing you up to 100 years old and not anything more than that. So my recommendation is definitely to consider the dental implants irrespective of your age. Definitely to have a quality of life, because implants can dramatically improve your chewing and speech and comfort, and definitely offering a permanent solution to those missing teeth, which definitely is going to enhance your life. And particularly if you're 78 and if you're healthy, you even have a better reason to why you want to maintain those teeth, because you don't know what's going to happen in the next few years, and as you go downhill, you may not be even healthy enough to receive implants. So continue to stay healthy, get the implants. And as far as the benefits, and we already talked about, definitely an investment. If the cost versus the benefit, if it is something within your budget, definitely go for an all-on-4, irrespective of the ages. And I have had patients in the past, and they're 80 or 85 years old, they're still getting married, and they want to get beautiful teeth for their wedding, and so they want to get implants and beautiful looking teeth. So you may have some health risk, and I don't know about your health, and you may have, like, depending on your health, and can you be at an increased risk for any type of implant complications, talk to your surgeon. Definitely talk to your implant specialist, and they should be able to explain to you the benefits and whether you should consider it, whether you're a good candidate or not. Again, I'm considering your lifespan. It is very important you evaluate, and this is something that you want to do. And my recommendation would be to go for it, and it is definitely going to be your investment, which is worthwhile for the remaining years to come, which you really don't know.
I think we get that question every time with the age and the implants. It is worth it. Go for it, especially like he said, if you're in good health, I think you should go for it. All right, our next question is, Dr. V, can holiday diets, such diets rich in starches, sugars, and acidic foods, worsen gum disease?
Absolutely, yeah. So the holiday diet, this is a killer, right? Because now you already mentioned starches, sugar, acid, like all of the above, right? And it is definitely going to worsen the gum disease because sugar feeds bacteria, starchy foods, they kind of stick around, and acidic foods, cause erosion of the teeth, and it can peel away some of the gums, and all of the above can cause dry mouth. So bacteria from the sugar, sticky foods causing like getting packed in between the teeth and the gums, and erosion causing the gums to peel away from the teeth, dry mouth causing all of the above, and it can definitely worsen the gum disease during the holidays. The best way to prevent them would be to balance with your brushing and flossing and rinsing after each meal, and then make sure that you're going to book your post-holiday visit cleaning with your dentist to restore the gum health, or even before you get to the holidays.
Yes,
so you're not going to get busy during the holidays and not going to be able to keep your dental health.
Yes. All right, guys, we got some live questions. So our first live question is, I have acid reflux and was told not to brush right after eating. Can rinsing and baking soda help protect my teeth?
Definitely, the answer is yes. And with the acid reflux, and it is sometimes kind of hard for the dentist or periodontist about to say whether it really comes from the brushing or it could totally be exclusively from the erosion. And rinsing with the baking soda, can it help? Yeah, to a degree. So definitely rinse with the baking soda because it's just going to neutralize some of the mouth acid that is coming into the mouth from your acid reflux. But again, only it can happen to a degree. So if you particularly if you have acid, sometimes you can, when you have the regurgitation, you can actually have the acid, you can feel it in the mouth. So once you have a feel of the acid in the mouth, you can't go to the bathroom immediately and start brushing, because now you're going to cause more damage because the acid is sitting in the mouth, making your tooth softer. Now you're going to brush immediately. Now you're going to cause even more damage. So make sure that you're going to watch for it. About 30 minutes after the brushing, is kind of about 20 to 30 minutes after any kind of an acid exposure, because enamel is really soft and it's kind of temporary. It is going to go back to its state. You can start brushing after. And rinse, don't scrub. So rinse your mouth. If you want to go to the bathroom immediately, you can rinse with water, and that's totally fine. And if you're brushing even after 30 minutes, and particularly if you have this acid reflux causing erosion, don't scrub. People have a tendency to go like this. No, you got to go in a gentle, like a scrubbing, like a circular motion, or it goes like a sweeping motion like that. If you scrub, then you are going to make more erosion of your teeth. And protect your enamel. You can talk to your dentist again. You can be using some fluoride toothpaste or fluoride rinses, and whether you are a good candidate for some kind of like a chemical that your dentist can apply, for example varnishes or like any other type of bonding agents they can apply, or if you have erosion, whether you need to have some kind of a filling. So your dentist should be able to talk to you. Best of all is to manage the cost. If you particularly know you have acid reflux, controlling the acid reflux through the proper diet or any medication that you may need to have is the long-term goal, and it should be your long-term goal to protect your tooth.
Yep. All right, it is rapid fire time.
What is that?
Okay, so listen. I'm gonna use 5 questions, right?
Okay.
So for the 5th question, you can only give them 5 answers, but you still can't simple answers. Simple. Do not.
So the 5th question goes first, and I can say five items.
Yes.
Okay. All right.
And then
okay.
4, 3, 2, 1.
Okay.
But it's rapid, so.
I gotta be quick.
Yes, you have to
okay,
be
man.
quick.
I'll try.
Okay.
I'll try.
So number 5 is.
So 5.
5. We're starting at 5.
Number 5. Okay, so you need 5 items. Okay.
So I need 5 items, 5 answers, rapid answers. Okay.
Okay.
All right. Number 5 is, what are 5 ways to distinguish between diet-related and gum disease-related bad breath?
Diet related is short term. Food smells that come from the tongue or from the stomach, and the other ones cause the gum disease odor starts from the gums. Gum infection often leaves like a metallic or a foul taste, whereas food odors could be completely different. They can fade away. And gum disease comes with the bleeding, swelling, tenderness, whereas diet is not. And the food odors disappear after brushing and rinsing, whereas the gum disease odor is not going to disappear until you get a proper care from the dentist.
You did good on that one.
Okay,
You did good. All right, number 4. As a dentist, what 4 essentials would you keep in your oral care kit apart from toothbrush, floss, and toothpaste?
A mouthwash, a tongue scraper to just scrape your tongue to remove all the bacteria. Interdental brushes, meaning like we call it proxa brushes, go in between the teeth, and then possibly like a water flosser, so we can just floss like whenever traveling.
Yep, I like that. All right, number 3. How can you differentiate between TMJ disorder and arthritis in the jaw in 3 ways?
Pain type. So on the TMJ, like if it is sharp and it is movement based, it could be like a TMJ. Arthritis is kind of more like a dull, like inside the joint. And inflammation, like with the TMJ, like, which is sometimes it could be like a muscle or joint related strain, as opposed to arthritis is like kind of a true joint swelling, because there is a lot of inflammation that happens inside the joint. And other signs could be like a clicking on the TMJ, clicking or a locking, and then arthritis is going to be more of kind of a stiffness, long-term chronic, and just like affecting your knee joint.
Okay. All right, number 2. If I floss twice on the same day, morning and night, does that make up for skipping yesterday? That is funny to me because it does not.
It does not. Well, you answered like you are answering it or me?
You answered
Okay, all right.
it.
Well, nice try. But the answer is no. Flossing twice a day is a must, and it does not undo the plaque from yesterday. So we say flossing twice a day is essential. If not, the worst case, do it at least once. Consistency wins, and daily flossing prevents the buildup on the plaque, and skipping even a day lets the bacteria to build up, and before the plaque hardens, just do it.
Yeah.
Go Nike.
Go Nike.
You got it.
All right, our last rapid question is, what's the most unusual question a patient has ever asked you?
Uh, well, I always get asked about the whitening because, particularly with the holiday time, people are asking about, hey, can I have white teeth, or I want to have a picture perfect smile, right? Even when the gums are in such bad shape, they need surgery just to save the tooth. It is like asking a fresh coat of paint on on a sinking ship,
Yeah.
right?
Yeah, if it's
You-
sinking,
you
I'm
have-
not going to put a fresh coat of paint on it.
Absolutely, yeah. So definitely, just with the holidays coming, pay attention on your gums as much
Gums.
as you want to do on your as much as you want to do on your white teeth. Yeah, it's very critical. Yeah, very very critical.
All right, we're gonna. You did good. You did good this time. Give me
Awesome.
some. Give me some. You
Awesome.
did. You did really good.
Oh, I thought we were going high five, man. Yeah. Okay.
All right. Our next question is: my gums have started to cover the brackets on my braces, and they're swollen. Can this be corrected with laser treatment?
Absolutely is the answer, and this is as periodontists, and this is one of the most common reasons we get referrals from the regular dentist or the orthodontist for this particular reason. Because guess what, laser treatments are the best for these kind of like reshaping or overgrown gums when the gums are starting to cover the brackets, because the laser gum treatment, it is precise and removes the excess gum tissue very gently, and ideal, very ideal for the patients with the braces where the gum tissue is overgrowing. And the laser and the gum removal helps with reducing the swelling in the area, reducing the discomfort, because the gum tissue is laying over up on the top of the braces. It is constantly hurting, and it is much better and quicker than the regular conventional surgery because it's non-invasive. And definitely consult with your orthodontist or your dentist who is doing the braces, and consult with your dentist and see whether this is something your dentist is able to do. If not, come see your periodontist, and if you're in the Dallas area, come see us at
ToothHQ.
You got it. Perfect. Yeah.
All right. The next question is: I heard that alum.
Yeah.
It looks like they want to say aluminum foil.
Well, kind of like that's exactly what it is,
Okay.
and that's where it comes from. Alum. Right.
Okay.
Yeah.
Can help treat gum disease. Is that true? And would you recommend it?
Alum is like, when I said aluminum, like it's not like aluminum, it is kind of like a chemical. That's what I was trying to say. Alum, we call it as a potassium alum. It is what it is a mild astringent, meaning like it constricts the tissue or handles the blood flow or reduces the blood flow. And it also has some antibacterial properties. So it is definitely good for like in certain cases. However, it can only temporarily do that by reducing your gum bleeding or the gum swelling, but it can't do that forever. And it is definitely not a cure for gum disease. Can it help kind of like put things down for like maybe temporarily? Yeah, it can do that. It is very, very short term. But don't overuse it. This is the problem. And people, when they use the chemicals, kind of overuse it, and particularly the alum being a chemical, you can pretty much overuse it, and you can totally irritate the gum tissue, not just the gum tissue. Maybe you are going to even irritate the other parts of the mouth also. So the answer would be limited use of the alum. Go for a professional cleaning, and which is really needed for the treatment of your gum disease, and make sure that you are going to use, if you are going to use the alum or continue to use that, and just guidance from a dentist, and make sure that you're not going to do this as a replacement for the dental care.
I was just about to say that. Don't use it in place of dental care.
You got it. You got it.
All right. Well, Our next question is, how can I prevent cavities while breastfeeding a 6-month-old who already has a couple of teeth? Ooh, 6 months with teeth.
6 months with teeth. I want to show you guys something right here. See that? That's a baby toothbrush. Show. Clean your baby's teeth with twice a daily with a soft toothbrush. This is a soft toothbrush. You want to feel it? Here, see that? Like that.
Oh, it is soft.
Yeah,
That's
it's
really soft. Yeah.
So sometimes what we even say there's like just a small piece of gauze, like maybe a maybe his baby's blanket. As soon as you wash it, then just put maybe even some mouthwash and then a chlorhexidine mouthwash or any kind of a mouthwash you may have. You can just wipe it, and you can use like a little bit of a toothpaste, or you don't even put anything. All you have to do is like use this, put it on your finger, and you can just gently use this to clean your baby's teeth. And wiping not just the teeth but also the gum, because baby doesn't have teeth, only at the two front ones. So the other parts of the mouth may have something sitting there as well. So make sure that after each feeding, and you're going to wipe the gum away if the teeth aren't like completely in, because sometimes what happens is the gum tissue may be the tooth may be a little bit peeking inside the mouth, and it may be covered with the gum tissue. And make sure that you are going to avoid the baby sleeping with the milk in the mouth, which is not uncommon. That is going to increase the sugary the sugary stuff in the mouth, which is going to increase the cavity for your baby. And you shouldn't be, but if sometimes people are feeding the baby with some sugary drinks, and if you are doing that, and even some juice, and just don't do that. And you can gently put a little bit of a smear of the fluoride toothpaste like this on the toothbrush, like a finger toothbrush, the baby brush, or even the piece of cloth that we talked about, or even a small piece of gauze, and you can just kind of gently wipe it. And make sure that you are going to schedule your baby's first visit at age 1. That is very, very critical. People we see, we don't treat like a 1-year-old baby, but some of my like a pediatric dental colleagues, we tell them, and they get busy. They sometimes very busy with even some newborn babies. They are coming in there because sometimes newborn babies, they're born with some teeth, and people are bringing them. So it is not uncommon for them to get busy with a 1-year-old, because that's then when they get started with the dental visit. And then, as much as we talk about the baby self, this is something that often forgotten is the mom's oral health. Because when mom has bacteria, and she can pass it on, it can go through from mere nursing the baby, breastfeeding, or sometimes guess what? When the soother falls on the floor,
Oh yeah.
you're going to put it on in your mouth, and you're going to put it in the baby's mouth.
Yes, moms do that.
Moms do that, right? So that is very critical. You pay attention. The mom's mouth is healthy as much as the baby's health.
All right, we still have some live questions coming in, guys.
Mm-hmm.
All right.
Yeah, I see that. Yeah.
So, our next live question is, would swallowing a few pinches of baking soda with a swallow of water help to brush sooner?
Sorry, repeat that again.
It said, would swallowing a few pinches of baking soda with a swallow of water help to brush sooner?
If you're going to, if you're really looking for the, I'm still not following the question.
Yeah, I'm not understanding that question. We have another live question though.
Okay, what does that say that again? Okay, here. Okay, would swallowing a few pinches of baking soda with a swallow of water, okay, like maybe a sip of water, help to brush sooner? Okay, So I'm assuming what the caller may be asking, it may be related to one of the other questions that we talked about earlier, when you have acid reflux, because or it is very possible maybe after you eat something kind of sugary or something acidic. Now maybe they're asking, and from what I definitely see that they were thinking, oh, I ate something sugary, now I got some acid in the mouth, so can I go immediately use the baking soda to neutralize the acid with, and now they can start brushing the teeth.
Yeah. So that may have been related to that question.
Yeah, so that's what I think they're asking. So the answer is, like, you don't have to rush. Really don't have to rush. My recommendation is, because you really don't know what is the chemical effect, like, so you don't want to put a lot of chemicals. And my recommendation is, you can definitely use a baking soda, but don't rush into trying to override the mother nature a lot, because if this is something that you're going to keep doing on a regular basis, you may cause some damage. Can you do it once in a while? Of course you can do that. Even I sometimes, when I'm like, when I have a patient, then I'm kind of like eating in a hurry. Sometimes I go to the bathroom, kind of brush my teeth, because I don't want to get the food get stuck on in front of my patient. So when I'm talking, so you can cheat a few times, but you can't keep doing that consistently. That will definitely cause some damage here.
Okay. All right. Our next question is, Dr. Vadivel, can someone get gum disease by sharing food with the person who has gum disease?
Well, this absolutely, yeah. So that is the same, similar to like the mom was, but the other question that we talked about, mom breastfeeding with the baby, right?
Yeah.
Definitely. So we call in our office, and we call it as a, we have this brochure that we have in our office here. So we call it as a mouth body link. We have it like in our office for all our patients who come in. And then also we call it as a kissing link, as you guys can see here. Yeah. So when you have your spouse or your significant other, when they have gum disease, and you can definitely give it to them. So part of that spiel that we give them, you can definitely share your gum disease just by mere sharing of food or mere sharing of utensils. Okay, so it can definitely be transferred through the saliva. Again, sharing utensils, drinks, or even food definitely can spread the harmful bacteria. Risk is really higher when the other person has a very poor oral hygiene, where the bacteria is getting transferred from. And particularly if you're the person that you think you may be transferring to, if they have a weaker immunity, then it can definitely go from one person to the other person. But the gum disease itself, like, I'm not saying, oh, gum disease got like it just from here to here. It is a bacteria which causes the gum disease, which is going to spread to the other person. How do you prevent that? The person who thinks that they are going to pass it on, make sure that you don't have gum disease, and good oral hygiene, help prevention. And even if you are exposed and you think that you will be exposing, and then make sure you're going to get regular dental care. As you say, go
where? Here?
To your dentist.
Go to
dentist.
I'm thinking of something else.
Go to ToothHQ.
That's what I was about to say. Okay, so the gum disease doesn't spread. It's the bacteria.
You got it.
That you spread that causes the gum disease.
Correct. Yeah.
Okay.
Right. Absolutely.
Right. I got
it. If people contract if you say people, like, how do you catch cold? Like, if somebody sneezes and then you pass the bacteria to the other person, that's how they catch cold, right?
Yeah.
So the same way, when you have gum disease, when somebody is sharing the utensils or the food, and they pass that bacteria to the other person, and we all have bacteria in our mouth, and people who have gum disease, and they have this specific type of bacteria which are very high in count, and the other person with a healthy mouth, they don't have that particular bacteria, or the count is not that high. Now they share a bunch of
Stuff with them.
with them.
Yeah.
Now
Now
it
their bacteria
increases
is
their
high.
you got it.
Okay.
Increases their exposure and increases their risk. Yeah.
Okay. We got another live question, guys.
Mhm.
All right. Is it normal to hear crackling or clicking in the jaw joint when swallowing or breathing?
Absolutely, it's not uncommon for you to to hear the clicking or any type of discomfort or even the noise or anything when you're swallowing. What might happen is, like, when you swallow, your jaw kind of, like, particularly when you have what we call it as a TMJ problem, temporomandibular joint problem, when you're swallowing and you're probably, like, putting a lot more consciousness and you're thinking about too much because you already have a joint problem. So when you're swallowing, then the jaw position kind of changes. If you look at it right here, see here, I'm going to swallow. I can actually move I don't know whether you guys saw it on the camera or not. So when I'm, like, swallowing, for example, here, I could feel my jaws kind of moving, right? So that's when you are going to hear the clicking or the jaw, some kind of a noise inside. So to answer your question, yes, it is not uncommon for you to feel some kind of a noise in the joint when you're even swallowing. Yeah.
Now I think I hear something if I yarn too. If I
Well,
stretch too.
yawning for sure. Yeah, because what's going to happen is, like, see here, if I did that,
Yeah, it's like
you do
I
that,
can hear
like,
it just like
yeah,
click a little
absolutely.
bit.
But what happens is, people with the TMJ problem, they kind of, we call it as the jaw is kind of jerking. So when they open like this, like, see here, and then they open and then the jaw kind of goes to the side, or particularly when they close, now it is kind of like out of the jaw joint here, and then when they open, but when it goes down, it kind of jerks like
Okay.
that. So here, for example, this is the jaw joint right here. This is the way it looks right there. This is the jaw joint. So,
Okay.
which is kind of like what we call it as a ball and a socket joint. So imagine, like, doing that right here, like this, right?
Oh, that makes
So-
sense now.
So when you yawn too much, like, what's going to happen is, this is going to, imagine this is the jaw joint, and when you're opening, now it is going to come out like that instead of the jaw joint sitting in here. So when it comes out, when you want to put it back, when it goes in, it kind of, like, jerks a
Yeah.
little bit. Yeah, that's what causes the jaw popping to happen.
Oh. Dr. V, can teeth be replaced at the same time that they were removed?
What do we do replace the teeth with in the office?
Implants.
You got it, got it. So you have seen that many times. So
Yes.
when the teeth are going to come out, and we replace them immediately with the dental implants. So years ago, when the dental implants came out, and we were thinking, oh, anytime you have a missing tooth, you need a dental implant. That's what used to be the rule. Now the new rule is, anytime you are going to miss a tooth, you are going to plan for a dental implant, which happens immediately after. So the answer is yes, we call it immediate implant, and as you remove the tooth, the hole is already there. Put the implant in immediately, put some bone graft around it, and you get your final tooth. Sometimes we are able to put the crown at the same time as we extract and then put the implant in and put the crown. You don't even feel like, you're going to have a missing tooth. And it is very ideal, particularly when you have healthy bone or a fractured teeth, you don't have a lot of infection. Very ideal for healthy bone with no active infection. And as I said, it reduces the treatment time. It is as much as you are going to get your tooth on the same day. And fewer surgeries. Guess what? You don't need to have multiple surgeries done. You get the extraction, or sometimes you get the extraction and a bone graft. Now you don't have a tooth. Now you got to go back and you got to put the implant, then you got to wait. And you don't need to have multiple surgeries. It all happens one time and done. Sometimes it is not always possible. We talked about the infection. When you have too much infection or you have too much gum disease, and we don't recommend you consider putting in the implant at the same time. So we will recommend you wait on it in those cases, and we will give you some kind of a temporary, and it could be as low as maybe about 3 months, or it could be as high as about 6 months. And we will give you a temporary tooth, like if we are going to do that, and then definitely you will get the tooth like after a period of time. And it is very good. It is a very good possibility that if you are going to lose a tooth, your dentist will be talking about immediate tooth replacement, particularly when it comes to ToothHQ. Our rule is whenever the tooth comes out, an implant goes in. That's what our recommendation is. So with the technology that we have, the 3D tools and the imaging and the CT scans and all of that, it is definitely possible that we can give you the tooth on the same day or implant on the same day.
I was asked that if when they pull the teeth, are you able to get an implant the same day? I told them yeah, and they were like, well, can they put the tooth up there the same day? And I was like, you have to ask your doctor, but now I can give them an answer.
Absolutely, it is possible. Yeah, sometime we definitely for the front tooth, it is a given. More than likely, we should be able to, unless some odd cases that we are not able to do that. But sometimes back teeth, no matter what, you know that. Like sometimes we tell patients they forget, they bite on like a piece of food they should not be eating, and then they knock the implant away, and then they say hey, they didn't know that, right?
Or sticky foods too, like
absolutely.
Caramel is the worst.
Oh man!
Thing. Do not eat a candy apple.
Caramel. I have some bad dental crown, bad teeth. Like when I was a kiddo, before I got into my dental school time, I even remember eating like a caramel. Like it almost just took my crown away. Yeah. So definitely it can happen. Yeah.
All right. I think we got time for one more question. Doc, I've heard that using warm oil for oil pulling can yield better results. Is that true?
Do you know what that means, oil pulling?
I think oil pull. Somebody was telling me about oil pulling. Now, I don't know about it being the temperature of it, but I do heard it's like a natural teeth whitener. It also helps with like just removing stuff off the teeth, plaque, and I don't know about tartar and all of that, but I do know that it's a natural teeth whitener.
Well, that's exactly like what you're talking about here. So the oil pulling, it is kind of like a natural like remedy, right? Like our people think that it is a natural remedy because the oil pulling reduces the bacteria, and because it reduces the bacteria, it improves the oral hygiene. But as Fatima said here, you get some benefits out of it, but it is not a substitute for your brushing and the flossing or the professional cleaning, right?
Yeah.
Because that's what people think, oh, I'm oil pulling every day, so I don't have to go to the dentist. No, it is not. Also, we live in a modern medicine world. Like, there is no absolute studies they have been done, or extensive research has been done on the oil pulling. So there is absolutely, I cannot say by like in medicine we call it evidence-based research. There is no evidence-based research to prove that the oil pulling is effective, or particularly the warm oil is more effective than the room temperature one. But as we said earlier, if you are going to do it, instead of being it as a substitute, if you are going to do it on the top of your brushing and the flossing and the professional cleaning, go for it. Use a lukewarm oil, not very hot, to avoid irritation and avoid any kind of a damage to your tissues. And warm oil definitely, like, it's like more comfortable, slightly more comfortable, particularly with the holidays coming, the fall season we are in. A warm oil is definitely comfortable. and particularly if you are in a colder climate area, colder weather area, definitely it is going to be helpful. And also it may help with the flow of the oil, because when sometimes some of the oil, they can get like really sticky or hard, like, so by making it warm, it's just going to make the oil flow better, and it is going to improve your compliance because you feel good about it, right? Yeah.
Yeah, but guys, before we go, I do want to emphasize, still go get your cleaning, still go see your doctor, and just use that as, like, you know, in between time. You can still do it, but not just that at all. So
all right, guys. Okay, thank you so much for being a great audience, and we really enjoyed it, and we are really looking forward to seeing you guys and next month. And you guys have a very happy Thanksgiving, and we will see you guys next time. Thank you very much.
Bye.
Bye, y'all.